This video is sponsored by Johnson & Johnson, and I want to tell you guys a little bit about the patient roundtables that I get to do where I travel to different states and I go to in- and outpatient facilities and I talk to people living with schizophrenia or severe mental illness. I've been super privileged to be able to work with Johnson & Johnson to do these trips recently where I'm going to big cities, small towns, all over the country, and I've been able to share my story through these roundtables to over 1,000 people in person in over 15 different states. So I want to tell you guys a little bit more about these patient roundtables, what it is, more about the peers I get to talk to, and why it's so important to me. I always say that when I was first diagnosed with schizophrenia, it felt like a death sentence because I didn't know that it was possible to live a full and functional life with this diagnosis. I had only ever seen movies and TV shows where people with schizophrenia are portrayed as dangerous or they're locked away in facilities their whole lives. And it wasn't until I found peer support that I realized that there were people with my diagnosis who were living full functional lives with jobs and families and friends. And I just didn't know that was even an option. So one of the reasons that I agreed to do these roundtables is because it allows me to share my story and hopefully help someone else realize that there is life after this diagnosis. I've been doing these roundtables for like a year and a half now, and so we've been to a ton of different cities, a ton of different states. I had someone at Johnson & Johnson reach out and ask me after doing the Unseen and Unheard podcast if I would like to spread more awareness in person and be able to interact with patients and peers and other people who might be struggling with schizophrenia. They told me about this idea called patient roundtables, where they wanted to bring an advocate to inpatient facilities, outpatient facilities, clubhouses, and different places that people with schizophrenia or mental illness are living and working. And so this was really important to me because in the last few years as an advocate, I've done a lot more speaking for doctors and nurse practitioners and companies, and I haven't been able to do as much with peers. Ever since I was a peer support facilitator way back after my diagnosis, I did peer support specialist training, I did all that stuff. I love that. That's, like I said, that's what inspired me. That's what gave me hope in my own journey. So I was really excited for this idea. I wasn't really sure what it was going to look like or who I was going to be talking to. But now I've done dozens of these, and I get to talk to people from very different backgrounds in very different areas who have a lot of different needs and a lot of different family support. So not only do I get to share my story, it helps remind me that not everyone's journey is the same. Not everyone's as privileged as I am to have access to care, medication, treatment. Not everyone has family support. Not everyone lives in an area where it's easy to get resources or talk to a doctor or talk to a psychiatrist. And these events have allowed me to connect with people and remember that everyone's journey is different. I've had people reach out to me months after these events and tell me that they now are sharing their own story, or they're advocates, or they're working, or my story inspired them to start doing something that they didn't think was possible. And so I will continue to do these as long as they let me, because it means so much to me as an advocate, knowing that my story is making a difference in the same way that in that very first peer support group I went to, those people's stories made a difference for me. In these groups, when I'm telling my story, I'm talking to them about not just my diagnosis, but how I got through treatment, what coping mechanisms I use, all of the things I've experienced from my very first symptom to now, including my advocacy, everything like that. And we always save a ton of time for Q&As. And I mean, we will get questions for, I bet there's certain events we could have stayed another hour and gotten more questions. So the people I get to speak to care. I get a lot of questions about advocacy and about getting back into the workplace and learning to take care of yourself, learning to function on medication, learning to share their own story. And every time I go, I get to hear new questions, and it shapes how I tell my story to the next group. The people I get to meet are incredible, not just the patients, but the staff that invites us into these facilities. I said at the beginning of this that I really hope to inspire people when I'm at these events, but they also inspire me because I get to see people who are in first episode psychosis or just starting off on their journey. And they're so motivated. They're so excited about their recovery. They really remind me how I was when I realized that that wasn't going to be my whole life and that I could do other things, even if doctors and psychiatrists thought I couldn't. A lot of them also have more in-depth questions about medication and treatment, but I'm not a doctor, I'm not a psychiatrist, so all of those questions get referred to their healthcare specialists, they get referred to staff. I don't address those, so I do want you guys to know I go in as someone who's sharing my lived experience. I don't claim to be an expert, I don't claim to give medical advice, I don't do any of that. I come in to tell them about my journey and tell them what got me through, and I talk to them about finding hope in their own journeys. I want to thank all of the teams at J&J, especially the people who travel with me, like Candace, Karen, Noah, Marissa, and other people who have been a big part of me being able to get out and do these events and making sure that I'm okay while I do this, because travel is stressful. And it's only been the last few years that I really started traveling a lot. So thank you so much to all of them and all of the teams that make this possible, because working with peers and patients is what started my advocacy. It's so important to me that I continue to do that, and this allows me to do so. I want to do a more in-depth video about these patient roundtables, so please let me know specific questions or comments you have about these. I know some of the people I visited follow me now, so if you're one of those people, let me know down in the comments. I appreciate you. I love you guys. Be sure to like and subscribe and follow along for more content about schizophrenia and mental health. Thanks, guys.